Hello everyone, I'm Dr. Pragati Shubha. I'm a rhinoplasty surgeon practicing in RECON, Gurgaon. Today let's talk about a trending topic, non-surgical rhinoplasty or liquid rhinoplasty. So let's understand what it is. So when we talk about rhinoplasty, as in our earlier videos we've already discussed, rhinoplasty means to change the external shape of the nose. It's usually done for cosmetic or aesthetic purposes. Now when we talk about liquid rhinoplasty, liquid actually comes from the product that we are using to do rhinoplasty. In liquid rhinoplasty, we are using hyaluronic acid fillers, commonly known as dermal fillers, to change the shape of the nose. Now these are non-surgical procedures, they are not permanent, however they can produce some great results if the patient selection has been done wisely and correctly. So what are the few common indications that we can do liquid rhinoplasty in? The first common indication is in case of a patient who has a low nasal bridge. That is, the bridge of the nose is not at the appropriate height and we have a low nasal bridge. In these cases, we can put fillers all along the nasal bridge to increase the height. The second common indication is in case of a nasal hump. In case of a nasal hump, the product or the filler is deposited above as well as below the nasal hump to kind of camouflage that hump and give the illusion of a straight nasal dorsum. The third indication is to give a bit of tip enhancement right at the tip. So if they have a bulbous tip, we can again deposit a little bit product either at the nasal tip or right at the bottom of the columella to also increase the height as well as definition to the nasal tip, particularly when it's a drooping tip. In some of these cases, when there's an alar flare or when the nose widens when we smile, we can also combine it with a little bit of Botox in the muscles causing the nasal flare. That also becomes part of your liquid rhinoplasty. These are three common indications. Apart from that, anyone who has a very depressed radix or the root of the nose is very depressed, we can also do dermal filler in those cases. The fifth indication that we are doing dermal fillers or a liquid rhinoplasty is post-rhinoplasty. If there is a small defect and the patient is not ready to undergo another surgery, we can camouflage those small defects also with dermal fillers. Now it's very important to understand that though liquid rhinoplasty is an easier route to go because it's non-surgical and there's no downtime, not all patients are the right candidates for dermal fillers or a liquid rhinoplasty. So patients who cannot get a liquid rhinoplasty are patients who have a broad or a wide nose. In those cases, again, a liquid rhinoplasty doesn't work. Someone who has a crooked nose, again, a liquid rhinoplasty in those cases will also not work. So though the limitations or the indications for liquid rhinoplasty are limited, it's a great procedure which patients can undergo while they're also taking time to make up their mind to undergo a surgical rhinoplasty. I hope you found this information useful. For more information and more videos on rhinoplasty, do subscribe to our channel.